When it comes to MASPE, obviously we're going to be expanding the upper jaw quite a bit wider, and there's going to be some obvious enhancements or changes to the facial profile. A lot of people will have smiles that aren't that wide and they don't feel their cheek spaces, so you can see in here that there's like some space. So obviously if you're expanding, of course in our office what we try to do is we try to expand and move the teeth at the same time, so there's not any physical weird spaces between the teeth. But if the jaw is getting wider and the teeth are getting moved around in a wider palatal area, when we smile, we're going to have a much wider, better display of teeth. So that certainly is a enhancement in our cosmetics. Also, if the upper jaw is getting a lot wider, our maxilla, our upper jawbone, connects to our cheekbones, and at the same time our upper jaw gets wider, our cheekbones are going to expand out. They're going to become more prominent. Some people have like really thin tissue, some people have thicker tissue, some people have a little bit more fat in their cheeks. So the actual enhancements with the cheekbones getting larger, more prominent, can be case to case. For people that have thinner tissue, they're going to see that cheek enhancement a lot more. For people that have more cheek tissue, they're going to see it a little bit less. But generally speaking, people that have like some wrinkles in here or some like loose skin tissue, that's going to fill out and be better supported, and that's certainly going to be a cosmetic enhancement. The one caution that I'll give with MASPE is people have smaller, narrower, not as conspicuous smiles, facial features. When you go to expand that, you're actually going to be getting the face quite a bit bigger and more noticeable. So if people have any existing facial asymmetries, as the face gets bigger, those asymmetries, if they're not addressed, are possibly going to become more noticeable. So that's sort of a proceed with caution thing. In our cases, we will take a look at the facial asymmetries and include that variable in our workup.